Welcome to the Pain to Progress podcast, where we help you overcome pain, restore function, and get back to doing what you love without unnecessary surgery. My name is Dr. Tom Sellers, a sports medicine physician, and I believe in the body's innate ability to heal and the power of taking ownership of your health. Whether you're an athlete, active adult, or just tired of living with pain, this podcast is here to guide you from where you are to where you want to be. This is Pain to Progress. Hey everyone, this is Dr. Tom Sellers from Sellers Sports Medicine and Family Practice. I'm excited to share some news with you guys. We're starting a podcast. It's called Pain to Progress. I'm very excited to get this started. I want to share with you guys a little bit of why I wanted to do this. So for me, education's huge, and pre-education for our patients and prospective patients. I really want people to know that there are more options than just surgery for their chronic pain, for their functional deficits, things like that. There's a huge area between very conservative, borderline ignore the pain and ignore the problem, and then the ultra aggressive approaches with surgery and removing things and cutting things out and all that kind of stuff. So I'm really excited to live in that middle ground and to talk about some really amazing therapeutic modalities that we have, different injection-based strategies, different therapies that are just helping people a lot. They're helping people get out of pain, become more functional, and get back to what they do, what they were doing before, and get back to what they love. At Sellers Sports Medicine, we're very patient-centered. We spend a lot of time with our patients, but even in that time slot, you can't get everything in a half an hour, an hour. You can't learn about all the different things that we can do and the technologies behind it. Of course, in this podcast, we're going to put things out in an easy to understand way, in many times layman's terms, but I want this podcast also for people that want to do a little bit more of a deep dive, learn more about some of the background of why we do things and what kind of the technicalities of some of the procedures that we do and some of the therapies that we do. To learn more about it, our patients many times are active individuals, or at very least want to be active, but they're limited very much by pain, joint pain, tendon issues, injuries, chronic pain, things like that are really limiting them to getting back to what they love. A lot of times when you have lots of pain, a big part of what makes you is kind of lost, and we want to help restore that and people to regain their identities and regain their activity. And so I'm very excited to dive into these kind of things a little bit more and have really good hosts that are some of my very trusted medical professionals and colleagues and things like that. Many of my patients, like an example would be somebody came to me with pretty severe knee pain, functional deficits, really kind of not being able to do what they love. They're avid pickleball player before, but they had a small little injury that cascaded into weeks of pain, months of pain. Now they're not being able to do what they want to do, right? They can't hang out with their grandkids, pick them up. They can't bend down well. They can't play pickleball, of course, either. Like those kind of people, they go to, the normal progression is going to maybe primary care, send them to the orthopedic surgeon. They say, well, really knee replacement's the only way to go. The arthritis is too severe. Well, many times we have injection therapies that can help tremendously with pain and function without surgery. Yeah, so one of the great things that we have at our practice is Platelet-Rich Plasma, or PRP. This can help tremendously in terms of pain and functional scores in joints and tendons and things like that. For me, PRP has unlocked an amazing little zone of getting people back to doing what they want and doing what they love. And so within that, PRP and platelets in particular, they're not quick fixes, but it's from the patient back into the patient. It's a natural way to increase your body's normal healing process, reset that signal of healing, that signal of good, healthy immune function, good microenvironment, and get them back into a better zone. And that's a zone of healing, of course, but also a long-term anti-inflammatory solution. So this is just an amazing tool for us without the use of steroids, and that's just kind of, nuking your immune system. That's destroying your immune system. That's not a pro healing environment, that's just big band-aid, can also worsen the microenvironment too. We know this. So you can have arthritis earlier, cartilage degradation earlier. It's horrible for the tendons. Those things can pop if you do it in the tendon. And so, with all these risks involved, a lot of my patients still say, well, I've just gotten steroid and steroid and steroid, and they never get better. In fact, they get worse. So that's where PRP, platelet-rich plasma, and other injection-based therapies like MFAT that we do as well. That's where it just really can excel. People that need that extra push, that need that pain and functional increase, that don't want steroids. Steroids we know are toxic to the cartilage, tendons, and joints. These are the types of conversations and topics that I want to address with my guests on the podcast. Make sure that we talk through how their perspective is on increasing the chances of healing and to help promote healing and help really kind of get people in a better pain and functional zone. I want to know from their perspective and their medical profession and their qualities of how they can get things in a better zone. But I also want to share and share information on how I have been able to help patients with return to play, return to functional capacity, and pain levels. So some of the guests that are coming up, I have some personal trainers, physical therapists, RMSK ultrasonographers, and then also I'm very excited. I'm going to be interviewing and talking with my dad on the first podcast. It's Sellers Sports Medicine. It's a father-son venture. It's a father-son deal. Both Dr. Sellers, and I'm very, very excited to talk with my dad. We're going to go over a little bit of everything, a little bit of the history of how sports medicine has changed, and then absolutely dive into what we're doing today and how we can help patients a lot. Make sure that you subscribe to our YouTube channel and follow us on social media so that you can be up to date on when new podcasts are coming out and new content is released. Very soon, a couple weeks, we're going to have our first podcast, and that's me and my dad, Dr. Joel Sellers. So can't wait to see you there.